Dr. Carlos Alvarenga Cardosa, in addition to our distinguished presenters and commentators from the IDB, the World Bank, and indeed from PAHO. And our event today will be closed by our Assistant Director, Dr. Rhonda Seeley-Thomas. A few remarks on logistics. We have simultaneous translation available for you, so please feel free to select your preferred language below. And we do look forward to receiving your comments in the chat, which is now open to facilitate engagement. So let me now pass over the floor to Dr. Barbosa, Director PAHO, for opening remarks. Dr. Barbosa.
Thank you, James. Let me just a moment. Okay, gracias, James. Mi querida amiga ministra de Saúde do Uruguai, doutora Cristina Luxemburg, vice-ministro de Gestão e Desarrollo de la Salud de El Salvador, mi querido amigo Carlos Gabriel Alvarenga Cardosa, Dona Tânia Dimitrachenko, gerente para América Latina e el Caribe, Prática Global de Salud, Nutrição e Poblação do Banco Mundial, nosso sócio nessa iniciativa para fortalecer a atenção primária, assim como também outro sócio importante dessa iniciativa, que é o Banco Interamericano de Desarrollo, aqui representado por meu querido amigo Javier Guzmán, chefe de Divisão de Saúde, Nutrição e Poblação. Nossa subdiretora, Rhonda Seeley-Thomas, viu que estão conectados nossos representantes desde o Uruguai e desde El Salvador, e colegas de outros países e aqui de departamentos e unidades da OPS. Muitas
From
gracias.
various PAHO departments, thanks very much for your participation. Our meeting today is a fundamental step in the strengthening of our health services and to ensure health rights for our peoples, an objective shared by all. The consensus on integrated health services that is promoted jointly by PAHO, the Inter-American Development Bank, and the World Bank is a milestone in our region. With this initiative, three leading organizations of the Americas confirmed they're committed to work in a coordinated manner to align evidence, experience, and knowledge to accelerate the transformation of health services for the benefit of all regional communities. This is based on the important lessons, the lessons that were left by the COVID-19 pandemic, which made clear that we needed to work together, and also our renewed commitment to move towards equity, solidarity, and sustainability throughout the region, because only by joining efforts and responsibilities shall we be able to build stronger, more just, and more resilient health services for all. The Alliance for Primary Health Service in the Americas, created in 2023 in Montevideo, Uruguay, precisely, was born with the determination to speak with a single voice, to strengthen universal health through primary health services. Our presence today is a concrete example that cooperation is not only possible, but it's an indispensable strategy for our region to successfully face the challenges of public health. The integrated framework of health networks responds to this objective. We are aware that fragmented systems do not create resilience. However, integrated and integral networks with a focus on people and based on the various territories do. Integrated health service networks include primary health care adapted to the local conditions and transform principles into practice to assure access, continuity, and equality for all, never leaving anybody behind.
are essential to ensure that the priority public health programs, such as maternal and child health, the prevention and control of communicable and non-communicable diseases, immunization, and preparedness and response to health emergencies, operate in a coherent and integrated manner, achieving the greatest possible impact that our populations expect and deserve. However, we must also recognize the critical challenges that lie ahead and focus our efforts on several pressing priorities. These include sustaining political and technical alignment among all actors, securing adequate financing for primary health care even in fiscally constrained times, and ensuring that ministries of health have both the authority and the capacity to lead the necessary reforms. These are precisely the areas where our collective action can generate the greatest and most lasting impact. Let me close with one crucial message. Universal health is not just a slogan. It's a shared commitment, one that demands structural transformation, sustained political will, and genuine collaboration across institutions. Today's technical consensus demonstrates that our institutions can come together and, most importantly, act together with clarity, coherence, and conviction. On behalf of the Pan American Health Organization, I wish to extend my sincere gratitude to all colleagues who have contributed to reaching this milestone. As we look forward, we reaffirm our commitment to working side by side with the Inter-American Development Bank, the World Bank, and our member states to turn this shared vision into a concrete reality. Together, we are building universal, equitable, and resilient health systems that truly serve the people of the Americas, turning our shared vision into lasting health and well-being for every person in every community across the Americas. Thank you.
Thank you very much, Dr. Barbosa, for those opening and very comprehensive remarks. Colleagues, we have over 750 people now connected to our webinar this afternoon. As we have heard from Dr. Barbosa, the consensus through the Alliance for Primary Healthcare that has been achieved really brings us together for the first time, both at the technical and programmatic level for the three institutions. So based on this shared objective, we have arrived at this consensus on a technical document around integrated health service delivery networks. What we want to hear now is, and we really invite, and we're so pleased to have with us the Minister of Health of Uruguay and the Vice Minister for Health of El Salvador, to share some country experiences on how such a process, how building integrated health service networks are so critical to the overall achievement of health objectives at the national level. So let me first invite Dr. Cristina Lustenberg, the Minister of Health from the Ministry of Public Health in Uruguay, to share her experience and the experience of Uruguay around integrated health service delivery. Over to you, Minister.
Bueno, buenas tardes, Shane. Voy a hablar en español.
And we'll be speaking in Spanish. James, okay?
Excelente.
Very well.
Buenas tardes.
Good afternoon. And in the first place, I want to greet the Mr. Charles Barbosa, Director of PAHO. I was not able to attend the last meeting for a number of force majeure reasons, but every time that you call us to work together for our region, also the Dr. Bascala, primary healthcare head at PAHO, and Mr. Chris Didera from the World Bank. I also heard that Mr. Luchenko, Ms. Luchenko from the World Bank is also with us, and also greetings to Mr. Carlos Alvarenga, Vice Minister for Health in El Salvador. Together we will be sharing our experience in our experiences in the development of integrated healthcare services. The Uruguay's service was started in 2005 with the new administration in March this year, but the foundations had already been laid down in the government plan, and that eventually led in the year 2007 led to the corresponding law that organized health coverage in care networks and established a strategy. The primary health service. This required a number of organizational changes to assure universal healthcare based on the PAHO and WHO's strategies. It is supposed to assure the financial coverage of the members of the network that are mandated to provide benefits plan to users, including services and medicines explicitly mentioned in our country as the comprehensive health services. In 2005, Uruguay spent 3.55% of our budget, but in the accounts for 2023 that had reached the 6.5% and 722% pocket expenses was 16% in 2017. However, there are still some gaps that needs to be addressed, like waiting lists that are for some services that are still above what is acceptable, inequities in access to the services for certain groups because of their territorial location or condition of vulnerability, and the challenges in the field of mental health and a comprehensive response to gender violence. The government's healthcare services that includes over 1 million users across the Uruguayan territory adopted the integrated networks, and with support from PAHO, we created the integrated service on a regional basis in 4 regions, which is still in place, and it was critical in addressing the COVID-19 pandemic. In the regional forum in December 2023, Uruguay joined the Alliance for the launching of a primary health in the Americas that ever since has sought to articulate throughout a region all technical and financial cooperation efforts from the World Bank, the Inter-American Development Bank, and PAHO. In July 2024, Uruguay communicated its interest in joining the alliance and was favorably responded by Dr. Barbosa from PAHO in December that year. And that's why we are very pleased to see that this update in the operational and conceptual document for the network should contribute to strengthen the synergies through the efforts and contributions of these 3 institutions, who will join in a coordinated effort to avoid duplications. The new integrated framework should be a point of reference for commitment to overcome inequalities in access, the fragmentation and the segmentation that still compromise the quality of care and equity in our health systems. We will soon make a call for PAHO, IDB, and World Bank representatives in Uruguay to set up a national coordination table that, based on the document we're launching today, will provide new momentum to the cooperation and the cooperation efforts in the countries. Thanks very much for inviting us to this panel, and rest assured that we are committed as a government and the Ministry of Health to strengthen regional integration and in our countries in particular. Thank you very much, Minister Lutzenberg. Pleased to meet you and to listen to you again. Thanks very much for your interest and support to the process to continue strengthening the alliance in Uruguay. And now we're going to turn it over to the Vice Minister for El Salvador for Health, Mr. Alvarenga, to hear about the El Salvador experience and the building of these integrated health networks. Vice Minister, over you. Thanks very much, James. Greetings to Dr. Barbosa and Dr. Barbosa, Director and Vice Director at PAHO, the representatives of the World Bank, and Dr. Bascalo and Monica, and also Dr. Listenberg, Minister for Health in Uruguay, to our colleagues in the Alliance in the Americans. For us in El Salvador, it's really a privilege to share in the launching of the Alliance Technical Consensus and to share El Salvador's experience in building the consensus. The objective is how to provide these services for our communities. Health services are very complex and it requires a lot of craft. El Salvador is not new to the networks in the Americas. Previously, also as in many other countries in the Americas, there was a fragmented approach, but the integrated approach was launched in 2010, including the community teams. And although this was a good, valuable initiative, this surrendered to the curative approach. But what did the pandemic teach us? It posed a number of opportunities and lessons. There was a crisis, but the best organizations also are born from these crises. We learned from the COVID, but we used that to move to a new normality and strengthen our health service with a systems approach. But what is a system? A system is a management tool, and on that basis, we created input, process, and output model to create results and impacts. And underlying this, the social context. The characterization of this model is that results-oriented. We did not focus on solving problems, but on the ways to provide continuity and a continuous improvement to the system for the benefit of the patients and the communities. And the strategic allies are also an important component. But how to make this health model, how this conceptual framework of a health could be made operational. Here we adopted 3 PAHO initiatives to make this system operational. In the first place, health census, alliances for primary health, and the health network. The IHSDUs. And then we started an action plan in 2023 that was launched in 2024. This is the second country to launch the Alliance for Primary Health in December 2024. And this strengthened the governance, and we set up the primary health care roundtable focusing on governance, the health networks, human resources, and management, and the digital transformation. Human resources is the most important component in any organization, but digital transformation is becoming a powerful engine to change health services across the world. In October, we just concluded the World Bank, PAHO, and IDB workshop to strengthen technical cooperation in the framework of integrated health networks. We adopted IHS-DU as a guide for this movement aligned to the integration access. What has been the foundation of that? In the first place, IHS governance to assure strategic planning, articulation at the 3 levels of care, and macro, intermediate, and micro management. Sometimes from the top, we cannot see what's happening at the bottom. That's why it's important not only to strengthen macro management, but also middle management and the micromanagement that makes all this operation. We have been working on organizational changes. We have established organizational categories from specialized centers, third, second, and first levels of care, community care, and pre-hospital care to strengthen also medical emergencies for the entire country, including different types of transport, air, maritime, and land transport. We have created this primary structure for all our health services, but we have also set up secondary networks that are very important because these are specialized networks. How these programs articulate these networks for mental health, palliative care, mother-child, rehabilitation care. These are all functional components of the organizational functional organization. It includes early identification, outpatient, palliative, and other types of care with a focus on families and communities. And this categorization and this service supply is becoming increasingly specific so that we can go from going from the various levels to the health promotions and also horizontally with the clinical guidelines that are practical systems to assure quality clinical practices. What have been the most important achievements? Like hearts, for instance, we are the leader in the Americas in implementing the heart strategy. We have also received last year the World Prize for high blood pressure care. We are reducing maternal cancer, including the
así como Crecer Juntos, la primera dama ha implementado precisamente la estrategia de nacer con cariño,
healthcare, also
y un sólido esquema de vacunación.
Early child care that has been set up by the Office of the First Lady. We have started to modernize and update the health facilities infrastructure. In regards of a digital transformation, this is a very powerful engine, not just to improve information services, but also to organize them and keep these systems. This is the bet that we're taking in our health service. Together with IDB and the PAHO, we have built our digital house. That's digital infrastructure that is a very powerful digital tool that involves
capacitar a los profesionales mayores. Esto ha hecho
digital
acelerado
natives
precisamente
to
la implementación de
train
la
the
tecnología
older
en el
generations
digital, un sistema de
that
referencia,
has
un
a
entorno digitalizado,
and a
expediente electrónico
reference
único,
system that is also
estrategias de
digital,
telemedicina,
the
teleatención y
telemedicine and
y herramientas
teleeducation and
digitales como la
telecare
inteligencia artificial que está incorporada en el
tools
mismo,
and
así como sistemas de información
information
importantísimos como los
systems
cuadros de mando estratégicos
like a
tácticos.
strategic
Talento humano, la impresión de especialidades,
command
el
protocols.
reconocimiento
In
del
regards of
Consejo
human talent,
Nacional
we
de
are
Salud y
strengthening the National
especializado, la
Health
construcción de un Centro
Institute,
Nacional de
the
Formación, Observatorio de
creation of
Recursos
a
Humanos y
National
educación en
Training
salud,
Center
la
and an
formación de
observatory of
personal.
human
Ha
resources and the
incrementado 2.4%
allocation of
porcentual del Producto Interno Bruto. Así que, y además
funding
el
has
financiamiento
been
social coordinado
increased
intersectorial y
by
apoyo territorial.
2 percentage
Bueno,
points.
para
And we have
finalizar,
also adopted
agradecemos
a territorial
la
approach
interacción en
to
estos
the
varios
integration of a
espacios
health
que se ve
service.
reflejado en nuestros indicadores de resultados.
We want
Reconocemos
to
que hay muchos
thank
desafíos,
for our
que debemos
participation
trabajar
in the
de forma integrada,
IHS
integrado, bajo el
DU
liderazgo fuerte
that
de cada
has
uno de nuestros aliados estratégicos como
led
OPS,
to the
y Banco
strengthening of
Mundial.
our systems with
Muchas
the
gracias,
support
doctor
from
Viceministro.
these three
Excelente presentación.
organizations.
Felicitaciones
Thank you
a
very much,
ustedes y al
Mr.
foro por la
Minister,
integración de todas
for
estas
the
iniciativas
outstanding
bajo el
presentation of the integration of this initiative under this
El Salvador ha tenido una larga experiencia en el
IHS
desarrollo de las
DU
redes y dentro de la
experience. We know
alianza
that El
para
Salvador has had long
mayor implementación
experience
y avance
in
para el
participating in this alliance,
Master's.
which
Así
has
que
allowed
muchas gracias por su
to
presentación.
move faster
Let me
along
now
the way.
switch to English and invite our own unit chief, Primary Healthcare and Integrated Health Services from the Department of Health Systems and Services to present the conceptual and operational framework for integrated health service delivery networks that we're actually launching this afternoon with our colleagues from the IDB and the World Bank. Ernesto, over to you.
Muchísimas gracias, James. Voy a compartir
Thank you very
pantalla.
much, James. I'm going to share my screen.
Me confirman que se escucha y se
Please
ve
confirm that
bien.
you can
Bueno,
hear and
en
see.
primer lugar,
First of
quiero
all,
empezar
I'd like
por
to
las gracias
start by
porque
thanking,
este es el resultado
because this is
final de
the
un
final
proceso
result
colaborativo
of a collaboration process
que solemos decir que
that
no solo es un
we
hito, sino que
usually
son
say it's not just a milestone, it's unheard of. Three
donde no solo hemos
institutions working together. We have not
el
only
compromiso
incorporated
de las autoridades y líderes
the
de las
authorities
empresas
and leaders'
parte de la alianza,
commitments in the
pero
three
también
institutions
todos
that partake in the
los
alliance, but also
quiero
all the
especialmente
technical
expresar el
teams. I'd
agradecimiento a
like
nuestros
to
países,
especially
porque el
thank
legado
the
de esta
countries
sistematización,
because
esta
this
actualización
systematization, this
del
updating
marco de redes de servicios de salud
of
también
the
es el resultado
framework
del
for
trabajo,
the
de la innovación,
primary
de
health
compartir
care
experiencias por
in
parte de
the
todos los países de la
Americas
región.
is because we
Esto ha
share
sido un
experiences
trabajo muy
with all
intenso,
countries in the
profesor.
region, and this has been very intense
Formamos parte del
work.
2025, estamos
It
cerca del final
occupied
del año.
us
Esto es un
during all
excelente
2025. We're almost at the end of the year, and I think there's an excellent result that we need to share. Just a sec.
Por supuesto,
Of course,
como parte del ejercicio de la agenda
as part of the exercise and the work agenda for A4PHC, as our director and colleagues have said, we come from almost 2 years of work. There were points in which we worked not only in the region, but also in the sub-regions and globally, and we installed the main pillars in this alliance and its purposes. In the last years, and particularly this year, the last semester last year, and all these months, we have progressed intensively in work done directly in the countries, and this in making up consulting roundtables in 7 countries. We're also coordinating 8 other countries in work that has a perspective of primary health care, but also networks in all the countries we are working in. I'd like to highlight that at the same time, regionally and with lots of participation of colleagues and experts from countries, we have produced public goods. Just a couple of weeks in the directive, in the steering council, we launched the Lancet report. And in this case, the network of health care services and systems is very glad to have such a tool. One of the elements mentioned by Minister Christina Ludenberg, that is barriers to access to health services and fragmentation, not only in terms of service organization, but also in terms of our systems. Well, this has been one of our points of interest. We want to guarantee coverage and effective access to healthcare services. And here, I don't refer only to barriers that have to do with financial aspects. There are also non-financial barriers. I'd like to highlight here, and this is part of the result in a report we launched at the end of last year. There, we clearly saw that a fundamental barrier to access healthcare services, and the most important one, was organizational barriers. Even more so, this barrier questions how the PHC works, and also different health services working in different contexts. I refer to a publication from the IDB that acknowledges a challenge concerning primary health care, its resolution capacity and coordination of healthcare service networks. 1 out of every 5 beds, 1 of every 5 days of stay are actually things that could be solved at PHC. So it's fundamental to have a resolution capacity at PHC to improve equity conditions, reduce barriers to access, but also to improve efficiency of healthcare services. And this has different impacts in different contexts. In the case of Mexico and Chile, for example, it fundamentally affects non-communicable diseases. In the cases of Colombia and Ecuador, it particularly affects infectious diseases. This renewal means an effort for updating the most important components, conception and operationalization of these health service networks. 15 years have gone by from 2015 networks to 2025 networks. And as you can see, we don't refer only to organizational aspects that have to do with services specifically, but also to elements that are structural, that affect to a certain extent how the healthcare system works. There are radical changes we have seen in demographic, epidemiological, and social changes. And also, this is due to the technological complexity we have recognized. All these are additional challenges when we want to coordinate and guarantee appropriate operation of healthcare networks and access conditions, as I referred to before. So this new framework of healthcare services has three perspectives: macro, mid, and micro, at different points in the system, with a very clear inclusion of management, change management. It's not only diagnosing, but also operationalizing improvement strategies. And this is a case of the digital transformation, as the Vice Minister just commented very markedly in El Salvador, but also its integration to eliminate infectious diseases or improve care in the case of non-communicable diseases. Cases as Uruguay and El Salvador are important because we acknowledge their diagnosis and also generate strategies. As I said, result management requires improvements, concrete indicators related to organizational and institutional transformation, and all this required changing the configuration of healthcare networks. When I mean reconfigure, I mean updating the 4 domains and 18 attributes that are part of these networks. In terms of domains, territorial approach to organization of care. This is very much focused on people-centered care during their life cycle. Also, managing critical resources, not only drugs, inputs, infrastructure. We included central elements such as logistics, to a great extent, inputs are the ones that allow us to provide services, as well as human resources and digital transformation as central elements. Dr. Alvarenga just mentioned this fundamental point of governance. Governance is one of the aspects we need for transformation and change, not only in terms of territorial approach, but also in terms of social participation, effective social participation. And finally, financial resources. When we mention financial resources, it's not only having enough resources, but also the sustainability of these resources. All these elements have 4 integration axes. Integration of healthcare through life course with a people-centered approach, integration of programs focused on specific diseases, integration of public health interventions, integration of policies and approaches towards public health. And we find coherent in PHC in the 4 functions of healthcare systems. We acknowledge concrete results that have to do with access conditions, care continuity, improving resource efficiency, and efficient and effective use. To wrap up, I'd like to mention our next steps. An element I'd like to highlight is formalization and operation of a network among many countries in our region to foster this new conception of the IHSDNs. Also, we're going to launch the IHSDNs in the countries, in territories, using tools and validating them in the networks. And also, I'd like to highlight that this is the first of a number of technical documents that we'll produce within the framework of this alliance. We need to deal with specialized care, the resolving capacity of primary health care, and integration with broader public health programs. Thank you very much, James, for this
Many
opportunity.
thanks, Ernesto. Excellent presentation. Thank you so much. In the chat should be a few are asking where can they obtain the documents. So we put the link in the chat for you so you can download and read and examine the updated framework as Ernesto has presented. This work we have not done alone. We've done very much in collaboration with our partners at the IDB and at the World Bank. So now we'd like to invite Christian Herrera I'd like to first of all invite Javier Guzman, the Division Chief of Health, Nutrition and the Population. Javier, over to you for a few comments on the document and the processes around this initiative. Over to you, Javier.
Muchas gracias, James. Un placer estar acá.
Thank you very much, James. A pleasure to be here with all of you. Greetings to Minister Lustenberg from Uruguay and Minister Alvarenga from El Salvador, as well as our tier partners, Jarvis Barbosa and Ernesto, of course, Christian, and all the team that has worked jointly with us. It's vital to have our alliance show progress. This is an important milestone because clearly this update of guidelines is focused on an issue that has been debated for a long time and that includes elements that are the main challenges for healthcare systems in the region. We see how non-communicable diseases are becoming the main source of disease burden in a difficult fiscal context. We need efficiency, we need quality, and we don't have the best. It's important to have resilient systems in case of disasters, pandemics, and so on. All this is very much focused on how IHSDNs can help us to face these challenges. I'd like to highlight 4 points in this update. They have been mentioned, but I'd like to emphasize on them. First of all, governance. The Vice Minister mentioned it, Ernesto as well. Governance is essential because it allows us to understand structure, responsibility, decisions, and this document has an important approach on governance. And it's important to mention that. Also, change management. Change management is not easy. It has to be intentional. And of course, it needs to involve human talent and contextual conditions, cultural conditions in different countries. Guidelines are general, but implementations are particular. Thirdly, the importance of coordination among ministries. This is a challenge in the region. Our region is aging, and we'll have to have a very good interaction with care systems, with early childhood and functions, and also different organizations that work in healthcare. We have the initiative Vid Cuida in the IDB. We want to have a continuum of healthcare services beyond traditional services in hospitals. Finally, the last point I'd like to stress is the relevance of digital transformation. There, I need to mention El Salvador and Uruguay. These two countries have been central to the work done by the IDB. They have been the models we have used for other countries. After this conference, I'm going to El Salvador to meet Dr. Alvarenga, where we will have our Conectaton with more than 1,300 people working in connectivity. in the digital health Pan-American route. There's a very important space to work there, so that this catalyzing element, which is a facilitator, becomes true or comes true. So thank you very much again to all those that have made this possible. I'd like to reiterate that we are here for you in this Alliance for Primary Health Care in the Americas, supporting different territories and countries in the best way possible. Thanks, James. Thank you very much, Javier, for your words. Good travels to El Salvador for these activities, and your integration and networks will be a great opportunity, as we have heard the Vice Minister say. Also, I'd like to invite Cristian Herrera, who is Senior Health Specialist for Latin America and the Caribbean region for Health, Nutrition, and Population Global Practice.
Muchas gracias, James. Muy buenas tardes a todos.
Thank you very much, James. Good afternoon to you all. Minister Lustenberg, Vice Minister Alvarenga, Director Barbosa, Mr. Thomas, Javier, Ernesto, dear friends and colleagues from all the region. First of all, I reiterate that this work has been done in the context of an alliance where we have been working for 2 years now. Therefore, I dare say that we needed to have a first product from this alliance, which addresses something so relevant as integrated health services. So integrated health services networks. And we have been working, as I said, for 2 years now, and Javier and the IDB have said so. The World Bank is very much committed regionally and at a country level. And of course, we put collaboration in the center. This is a multilateral axis, and this example that our alliance is productive, that it is sustainable, and that it can be useful for countries and people are very good signals. So the World Bank would like to highlight and thank. There's a lot of generosity of all the people involved in this work too. Now, I'd like to go to the integrated health services delivery networks. All the countries in the region share this point of view, this perspective. They've been working on this for some time. PAHO has led this work for many years. They had this idea, this model. Now we have this consensus that has updated the IHSDNs. When I was a PHC physician, I referred a patient to secondary level, and I knew no more about that patient. On the other side, when a hospital detached a patient, then they lost the patient, and there was no social benefit. And also there's disconnection when someone doesn't receive social benefits anymore. The same thing goes for emergencies. And everything that has to do with public health. Ernesto has talked about PAHO resilience, which is the report from Lancet. And I'm giving all these examples because people live this on a daily basis. Almost 1,000 or more than 1,000 people are connected here, and they can witness to this. This model is, we'll say, is now updated, and we can take that to practice. And that's a big challenge. The big challenge is to do so with you, civil society, users, those connected with the healthcare systems in all countries, and we can all put this to practice together. These services will have more quality, equity, and efficiency, and it will be so if we can put to practice this technical consensus. We have made progress already. Dominican Republic is implementing a pilot for implementing and evaluating their networks in the country, and they're based upon this new model. It's very positive to stress this. We have the document, it's on paper, right? But now we have an example, Dominican Republic. There is already one step towards putting this to practice. The idea is to implement, adapt, and translate this into policies and changes that will benefit the system at large, including workers and so on, and of course, for the people at large. So I finish by thanking you all and making this appeal. We have to put this to practice. I pass you the floor again.
To Tanya and to Jaime also at the World Bank for your continued support and participation in this really important initiative. So colleagues, we have come to the end of our event. To close our event, I'd like to hand over to the Assistant Director of the Pan American Health Organization, Dr. Rhonda Seely-Thomas, for her closing remarks. Dr. Seely-Thomas.
Thank you, James, and good afternoon, everyone. Excellencies, Dr. Lustenberg, Minister of Health of Uruguay, and Dr. Carlos Alvarenga, Vice Minister of Health of El Salvador. Mr. Javier Guzman, Division Chief of Health from the Inter-American Development Bank, and Mr. Christian Herrera from the World Bank, of course, Dr. James Fitzgerald, Department Director of Health Systems and Services at PAHO, colleagues. As we come to the close of today's launch, I want us all to take a moment to reflect on the significance of this event. That is a collective achievement that reflects the joint efforts of the Pan American Health Organization, the World Bank, and the Inter-American Development Bank, working hand in hand with ministries of health, technical experts, and national teams across our region to improve the health and well-being of all of our people. As our director, Dr. Jarbas Barbosa, noted in his welcome remarks, this consensus document represents both a technical milestone and a political commitment to strengthen health systems and advance universal health in the Americas. The updated framework responds directly to the challenges our region faces, building on more than a decade of accumulated knowledge, lessons learned, and country experiences with integrated health service delivery networks. At its core, the framework sets out a theory of change that links integrated service delivery as the path to improve access, continuity of care, efficiency in the use of resources, and a greater capacity to address the social determinants of health. It is grounded in the conviction that resilient, people-centered health systems are essential for equity, development, and social cohesion. Today, we heard about the framework's innovations, including its reaffirmation of primary health care as a foundation of transformation, as well as other key elements such as clearer governance structures, a stronger territorial approach, change management as a driver of accountability, progressive maturation of networks that represents diverse country contexts, and digital transformation as a catalyst for integration. The country experiences shared by Uruguay and El Salvador remind us that integration is not just a technical exercise. It is also political, institutional, and cultural. It requires vision, leadership, and the active participation of communities. The insights shared throughout today's launch highlight several key lessons. Firstly, integrated networks are essential for universal health, bringing services closer to people and ensuring continuity of care. Secondly, countries may start from different points, but share a common destination, and this framework offers flexible, practical tools to guide the way. Thirdly, collaboration and solidarity remain indispensable between countries, international organizations, and partners committed to building stronger and fairer health systems. Finally, and most importantly, the time to act is now. The region cannot afford to postpone the reforms that are urgently needed. Colleagues, today's launch is a call to action, and together, with conviction and solidarity, we can make this vision a reality. Let us reaffirm our collective commitment to build integrated networks of health services that put people, families, and communities at the center, and to transform health systems across the Americas to achieve universal health. Thank you so much for your participation.
Thank you very much, Dr. Rhonda Seeley-Thomas, for those remarks and for presenting the vision, the way forward for us all. So with that, we conclude our event this afternoon. I want to really thank everyone for your participation and a very, very good afternoon to you all. Thank you and goodbye.
Thank you.